My name is Stephen Alsop, and this is the Ophthalmology section. We're going to start by spending some time discussing the eye and vision. Now, the eye is a very complex sensory organ that provides a glimpse into the central nervous system. It is composed of many different parts, each with its own function. Now, of course, the overall function of the eye is vision. Light rays entered through the pupil are refracted through the lens onto the retina. And of course, the image that is refracted onto the retina is going to be the reverse and inverse of the image that is actually seen. The ciliary muscle controls the shape of the lens. This is what allows you to adjust the angle of refraction. The fovea is the point on the retina with the highest visual acuity because it contains about half of the fibers in the optic nerve. Now, slightly nasal to the fovea is the optic disc. This is where the optic nerve exits. It is also your blind spot because there are actually no photoreceptors at the point which the optic nerve exits. Now, the retina, which is this yellow layer here, is composed of both rods as well as cones. Rods are more numerous, but they have poor spatial and temporal resolution, but they are important for black and white vision. Cones, on the other hand, are highly represented right here at the fovea. They provide for high visual acuity and are also responsible for color vision. The pupil is the hole in the center of your eye that allows light to pass through, while the iris is the part of your eye that gives it its color, and it also adjusts to allow different amounts of light through the pupil. The sclera is what is known as the white of your eye. That's represented by this gray layer. This is a tough connective tissue that covers the eyeball. The extraocular muscles actually are inserted into the sclera. The cornea is a transparent layer that protects the eye. Now, the eye can be thought of as being divided into two segments. In the anterior segment, the lens is bathed by a clear watery fluid called the aqueous humor. Dysregulation of the production of aqueous humor leads to what condition? Now, we'll obviously talk about this some more, but that condition is glaucoma. And glaucoma can be caused by too much aqueous humor in the anterior chamber. Like I said, we will discuss this in more detail a little bit later. Now, in the posterior segment, which is much larger, as you can see, the fluid there is called the vitreous humor. Now, don't get this confused with the posterior segment. This is the small area behind the iris and in front of the lens. Lastly, the choroid is the thin tissue layer containing blood vessels to the eye. It is sandwiched between the sclera and the retina. Aqueous humor is produced by the ciliary body. Try not to confuse this with the ciliary muscle, which controls the concavity of the lens. So this occurs in the posterior chamber, and the humor then travels to the anterior chamber through the pupil. It is resorbed through the trabecular meshwork into the canal of Schlemm. Aqueous humor has a number of different functions. However, one of the most important is the maintenance of intraocular pressure. You can imagine that maintaining that pressure is important in terms of how light is diffracted when it enters the eye. The last thing you want to know is that too little or too much pressure can lead to various problems, but one of the main ones is glaucoma. Although the USMLE does not test very advanced ophthalmology, you can expect to be tested on some common conditions. So it's important to know that near vision is achieved by the ciliary muscle contracting. This relaxes the lens so it is more convex. By the same token, distance vision is achieved by the ciliary muscle relaxing. This contracts the lens, flattening it. So refractive errors essentially stem from abnormalities of either the cornea or the lens that cause changes in refraction that the dynamics of the lens cannot account for. This leads to an inability of the lens to focus light onto the retina. So you should know that light has to converge at the retina in order for proper vision to occur. When this does not happen, it results in conditions such as hyperopia and myopia. Let's start with hyperopia. In hyperopia, the cornea and the lens are not able to refract light enough, and the point of convergence ends up behind the retina. Of course, this is not very helpful for normal vision. In myopia, the cornea and the lens actually refract the light too much, and so the light ends up converging in front of the retina. Astigmatism is the result of abnormal curvature of the cornea or lens, and this leads to different points of focus in the vertical and horizontal axes. The result, of course, is blurry vision. With aging, the lens become increasingly sclerosed, and so they develop problems with the ability to focus light. This is called presbyopia. And thus many elderly patients require bifocals. In elderly patients, glaucoma, macular degeneration, and cataracts can also develop, leading to additional mechanisms for vision loss. Now, this is a disease that increases in prevalence with age, and that disease is cataracts. The lens, which is normally transparent, becomes opaque, and visual acuity is reduced. Eventually, this will lead to blindness. In this picture, note the complete opacification of the lens as observed on a slit lamp exam. Now, sometimes it may even be more obvious, as seen in this photograph of a patient with a cataract that occurred secondary to trauma. You can clearly see the difference between the unaffected pupil and the one with cataracts. The pathogenesis is thought to be due to progressive oxidative damage to the lens, causing scarring and then healing by opacification. Risk factors for cataracts include age, smoking, alcohol, sunlight, and as in this case, trauma. If you see cataracts in children or young adults, you should suspect a congenital toxic metabolic cause like galactosemia or diabetes. Okay, it is time for another flash quiz. The question here is, how does the ciliary muscle change the shape of the lens? So you should know that when the ciliary muscle contracts, it relaxes the lens, making it more convex. This is important in facilitating near vision. In contrast, the ciliary muscle relaxation contracts the lens, causing it to flatten, and this is important for far vision. Glaucoma is defined as increased intraocular pressure from aqueous humor within the system. Open-angle glaucoma is caused by decreased flow through the trabecular meshwork and canal of Schlemm, and this can be caused by a buildup of a number of potential culprits, including red blood cells, white blood cells, or just retinal debris. Chronic closed-angle glaucoma is caused when the angle between the iris and the cornea blocks the flow of aqueous humor. This can happen in a number of different ways, including the lens moving forward against the iris or proliferation of blood vessels in the iris. Now, the most important thing to know about glaucoma for step 1 is that chronic glaucoma, whether closed or open angle, is associated with gradual loss of peripheral vision. Right? Gradual loss of peripheral vision. And this is for chronic glaucoma. Because it's gradual, you can also think of it as being silent. Most people don't even know they have it until a physician screens them for it using a visual acuity exam. This, however, is not chronic glaucoma. This is something entirely different. This is acute closed-angle glaucoma, and this is sudden onset, and it is very painful. It is obvious that something is wrong with this eye. A sample question on the USMLE might say something like, a lady woke up with severe right eye pain, headache, decreased vision, and nausea. You measure the optic pressure and it's 70 millimeters mercury. You should know that acute glaucoma is an emergency. Another important thing you should remember is that epinephrine is useful in chronic glaucoma because it decreases the production of aqueous humor. However, it is very harmful in acute closed-angle glaucoma because it leads to mydriasis, which further closes the angle. So epinephrine in acute glaucoma is a no-go. Uveitis is inflammation of the uveal coat. Now, the uveal coat includes the iris, the ciliary body, as well as the choroid. You can see the parts of the uvea shown here in red. Now, uveitis is commonly seen in many systemic inflammatory disorders. Here's an example. Now, the reason why we see it in so many systemic inflammatory disorders is because it is often due to autoreactive T cells. These cells recognize proteins in the eye and mount an attack against the eye. So how do you think this condition is usually treated? Steroids are usually the first-line therapy for uveitis if therapy is actually indicated. And this makes a lot of sense because we use steroids often as anti-inflammatory agents. Macular degeneration is a disorder that affects the central area of the retina, and this is important for seeing fine details. The most common form occurs in people older than 60 years old, and that's why it's usually known as age-related. It causes a central loss of vision called scotoma, as replicated in this photo. It usually starts out as dry MD, which is slowly but gradually progressive. On ophtho exam, you'll see drusen spots, which are basically these fat deposits. As the disease progresses, the central scotoma gets bigger, but peripheral vision is usually preserved. Then, in about 10% of people, dry MD progresses to wet MD, which is rapidly progressive. It is caused by neovascularization under the macula. Blood and fluid leak and further damage the macula. This causes acute vision loss, and the earliest sign is that straight lines begin appearing distorted and wavy. Take a look at this example. People who have dry MD screen themselves with this Amsler grid. When the lines become wavy, you know it's time to call the ophthalmologist, or stop doing drugs. Treatment is with VEGF inhibitors to prevent further neovascularization. Okay, it is time for another flash quiz. What is the treatment for uveitis? So as we discussed, uveitis is simply inflammation of the uvea, and that can be caused by a number of different things. And so the goal of treatment is to help inflammation subside, and steroids are a pretty good option for doing that.